Great. Okay, so this is Clive Smith, aka CS MGTOW. My guest today is a Professor Matthew Ganucci. He holds a PhD and is an assistant professor within the Department of Psychology at the Boise State University in Idaho. Thank you very, very much for joining me, Matthew. Would you prefer Matthew or Matt?
Call me Matt. That's fine.
Great, great, Matt. Thank you for joining us. Can you give
No problem.
the listeners a brief introduction, as to your kind of yourself, your academic interests, and the areas of practice that you work in?
Okay, sounds good. I'm trained as a counseling psychologist, and really my passion in both my clinical work and my research is working with men. And that happened to me when I was training as an undergraduate student. I had this moment where I was in class, and one of my professors was talking about some of the problems that men experience, and I just had this moment where I thought, wow, like I just really want to learn more about how men's gender relates to the distress they experience. And really from that point onward, I really devoted my class time. When I wrote papers on learning about men's gender. When I did clinical work in my clinical training, really wanted to work with men. So whether it was with college students, whether it was with veterans, I really wanted to understand about how to treat men more specifically. And so I really just tried to whatever I was up to try and learn more about how to help men, specifically men that are more traditional, have been socialized more traditionally,
Okay.
how to help them more. And so in my clinical practice, worked primarily with men, and then in my research, I focused more on depression in men and how to specifically look at some atypical depression in men and how to maybe understand it a little bit more and maybe diagnose it more specifically.
Okay, great, great. And I came across your really excellent paper in the International Journal of Men's Health. The paper was titled Anger and Hostility as Primary Externalizing Features of Depression in College Men. Can you tell us a little bit about the aims of your study and how it was designed?
Sure, I'm happy to, Clive, and maybe we can. I don't know if this is helpful. If this is going off track just a tad, but with kind of ground rules around this, when you get talking to academics and the work that they're doing, maybe just people in general, what they're passionate about, they can kind of go and they can talk, and I don't want to do that. But if we're going to get to a point where I'm going longer than you think, feel free to just interrupt me and
Sure.
refocus me. And I don't want to take longer than is necessary.
Sure thing, sure
This
thing.
is your show and your time, and I'm just here to be helpful.
I'm happy to have you here. It's great to have you on
um,
these.
so in this study, I was really trying to expand a previous study that I did, and so in
Okay.
our past study, we really wanted to look at it in a very focused way how anger was related to depression in men. And so we just had some ideas about, okay, so men who are socialized more traditionally, maybe they don't look depressed like everybody else.
Okay.
And so one of the things we might see that they're more angry. And we found that in our past work. We found that anger seemed to be part of the picture. What we wanted to do in this next study is we wanted to expand it more. And so what we decided to do is look at anger again, but we also wanted to look at not just internal, kind of the inside experience of anger, but we also wanted to look at how men express it. So we're going to see this anger, so whether it's physically, whether it's verbally. Then we also wanted to look at a range of other types of I guess the best word might be like components that we might see
Okay.
of men who are experiencing depression. So we looked at alcohol use, drug use, and we wanted to see, are these components going to be predictive of this masculine depression,
Okay.
is the word we use. And there are a range of different terms. Some people call it masculine depression, some people call it mass depression. But this masculine depression, this atypical depression, we wanted to
Okay.
see if anger and kind of hostility and alcohol drug use is going to be predictive of this different type of depression in men. And
Great.
that was going to be our main goal, was to look at and see if this is predictive.
Great. And I remember in the abstract of your paper, you described that kind of socialization as that these men undergo as a kind of hegemonic masculine gender role norms. Can you kind of explain that concept a little bit?
Yeah, definitely. That's hegemonic is probably a term that's used a little more like in
Yeah.
academic terms. Hegemonic really is just a fancy word that describes, we might talk about more traditional masculine gender role norms.
Okay.
So, guys being exactly the word that you used, Clive, like whether it's stoic, being strong, not asking for directions, not kind of wanting to like express emotion, things like that. That's really describing this traditional masculinity.
So the influence of masculinity on depressive symptom presentation is quite a fascinating area. What does the research in this area tell us before your study, and how has your work either challenged or kind of reinforced these beliefs?
Good. That's a great question. This is something that it's this kind of emerging, building area of research in psychology of men and masculinity, and so there is some research that shows that there is this relationship between masculinity or traditional masculinity, hegemonic masculinity, whatever word you want to use, and some of these atypical or the word that I use in the paper, kind of these externalizing symptoms. You
Yeah.
think of more like internalizing symptoms, like maybe being sad, down, or externalizing symptoms of I'm going to act it out in some type of way. I'm going to express the depression kind of in a more agitated, angry, aggressive type of way. And there seems to be some evidence for that in some other kind of previous work, like previous work by Jim Mahalik, Mike Addis, Aaron Rocklin. But we wanted to look at it in a way that was a little more holistically to see, do these symptoms predict an actual model of masculine depression? And nobody had really looked at it in a more predictive way to see if we look at these symptoms, do they look at it predictively to where we might say if there's a man in front of us and we see these externalizing symptoms,
Okay.
would we have this idea in our mind that there's an increased likelihood that he might be experiencing this masculine depression?
I see.
And so the idea in our mind was, would this maybe help us kind of start to develop this idea maybe more diagnostically,
Okay.
if we think of kind of predictively? And nobody's really quite looked at that.
I see.
And that was what our hope was.
Okay. And what role will a man's history of masculine gender role socialization play in how he expresses, depressive symptoms?
Well, what we would think theoretically is that the more he endorses or adheres to those traditional hegemonic masculine gender role norms, the more we would expect to see those externalizing, kind of more masculine types of symptoms.
Yeah.
And the less we would see is maybe more of those kind of typical, kind of sad, down, blue types of symptoms. That's the theory that we would expect. And there is some research that supports that the more a man endorses those traditional roles, the more he's going to express those typical symptoms. Now, we didn't find that in our study,
Okay.
which is certainly an interesting finding.
It is.
But there is research that does support that.
Okay.
That there's that relationship between masculinity, ideology, or masculinity and symptoms.
I see. I see. And I guess maybe just on a side issue. Sorry, I do apologize about that. That was my
No
iPhone.
problem.
So I just put it down.
We're all used to that these days.
Yeah. In fact, I was just going to ask you another question, and you can choose whether or not this forms part of the overall kind of discussion. But just from your research and clinical experience, are you finding that the traditional gender norms or roles that a man will self-identify with, will that impact the course of the actual depression, whether it's severity, whether the length of time that a man will be depressed? Do you have any kind of research, or would you like to possibly speculate as to that?
Yeah, I can speak anecdotally around that, and there might be research on that. But typically, what is going to happen is the more that man endorses those traditional masculine gender role norms, usually it's going to be longer before he comes into my office. And
Okay.
so we're going to see a more severe course because in general, guys that I see don't want to come in, but the more he endorses those roles, it is really like the last case scenario
I
before he
see.
comes into my office. And
Okay.
it's often related to a partner, perhaps, where it's been told to him that I will leave you, or we're going to end our relationship, something like that. There's been some type of message like that that's been told to him to where he has to go to therapy or a relationship will end. And so he's basically been coerced to come into therapy. And so he's in pretty bad shape
I
usually.
see. I see.
And we're typically going to see that with these much more traditional men. And so often they're quite depressed and in quite a bit of distress when
I
they
see.
come into the office.
I see. The reason I ask is, of course, that there was a study released by the WHO, I believe it was last year or earlier on this year, and the suicide rates when you compare males versus females, men are far more likely to commit suicide and far less likely to seek help for
Sure.
depression and other mental health problems.
Hmm.
For sure.
Yeah, absolutely.
And can you speculate as to the origin of the belief that is consistent among these types of men, that emotions such as sadness is inconsistent with a kind of hegemonic masculine gender role norm?
That's a really interesting question, and I don't know if I can quite get that maybe there's some individuals who are you know, cultural anthropologists and some people that have looked more at the evolution of culture over the course of time. So I think if I understand your question, I think you're asking about more like over the course of history, where maybe you have these beliefs come about
Yeah,
that men can express emotions, sadness, things
exactly.
like that. And certainly it makes us wonder about the men being involved in like in warfare and things like that, and having to be like tough and to be in these strong types of roles, and because of that, at some point learning that there's this exclusivity between toughness and sadness. But as far as where that came about, I wonder if that has partly plays a role. But as far as where it initially comes about, that's a great question, and I don't know exactly, where that is and where that initially comes from. I think that would be something really interesting to
Okay.
learn.
Okay. So because I guess I would love to find out, is it deeply embedded in our species that it's
Mm-hmm.
almost part of our biology, or do we
Mm-hmm.
pick it up culturally
Mm-hmm.
at a young age when perhaps a boy is told boys
Right.
don't cry? To
Right.
what extent does the culture and the biology just kind of play into that?
Right. That's it'd be a very interesting question.
Okay.
And we can kind of circle back around to it a little bit, maybe when we talk about some of the findings in the study and how it
Okay.
relates to other findings. It might
Great.
help us a little bit with that,
Great.
but still, I think it's really fascinating, and I don't quite know the answer.
Okay. Okay. And what were the results of your study?
So we found that looking at all of these different variables, right, to see how they would predict masculine depression in college students, we were particularly interested in college students. We found that what sifted to the top were anger, internalized anger, and you can look at anger in a couple different ways.
Okay.
You can break it down to how you experience anger internally, so that's partly the physical experience of anger, like when you feel like your heart rate really goes up and you feel tension, and also the cognitive experience of that, so the beliefs that are associated with anger. But then also there's the expressed part of anger, so when you say something or when you do something, like you hit a wall or you throw
Mm.
something, and so we found that only that internal part of anger
Okay.
was predictive of depressive symptoms, masculine depressive symptoms in men, as well as hostility,
I see.
and hostility being a certain part of anger that has to do with beliefs that
Okay.
people experience. So people who have hostile beliefs, they're almost kind of like these paranoid beliefs of like, you're doing these things to make me upset. People are doing things to bother me and upset me. And in fact, out of all the things that were predictive, hostility was quite predictive
Great.
of masculine depressives. It kind of sifted to the top as the most predictive component, which was interesting, I think.
I see.
And unexpectedly, some things that we thought would be predictive of masculine depression, like drug use, alcohol abuse,
Okay.
like verbal and physical aggression. Like, if this guy is feeling depressed on the inside, but doesn't feel like he can say, I am sad and I want to be tearful about it, we
Mm.
might expect that he would be irritable and grumpy and might be physically aggressive. That didn't sift out either. So there were
Wow.
some of
Okay.
those unexpected findings in that type of way. So that was certainly very interesting
It,
for
it,
us.
it most certainly is because I guess I would have expected that that those latter actions would be the ones that men would display if they're actually depressed, but that actually isn't the case.
Right, right. So, and of course, we have to think about that tentatively from one study with this specific group of students. And I
Okay.
think what it means for us is, well, let's look at this more and let's see if this is something that we continue to find, or maybe it's specific to this population, maybe it's specific to college students, but it's not what we anticipated. Now, the interesting thing about this study is that it does piggyback on some other findings that we've had, where I mentioned earlier, where we did find that previously men did endorse anger in addition to their other depressive symptoms. And
I
so
see.
here they also endorsed feeling angry, this internal experience of anger, as a part of this masculine depression. So I think what this study, in addition to my work that I've done before, embedded in some other research, is I think it's telling us that when we think of depression in men, that anger may be a significant component of it.
For sure.
That the men are feeling angry on the inside. They may not necessarily be expressing it, but they certainly are feeling angry, and we need to be thoughtful about that in understanding depression in men. I think we can think seriously about that.
For sure, for sure. But because one of the things that I remember that you mentioned within your research paper was that men are diagnosed with MDD, major depressive disorder, at notably lower rates than women. Would it be fair to say that's not because men suffer from MDD at lower rates, but more accurate to say that we currently diagnose MDD in a way that is possibly unsuitable for males but more suitable for females, or would that be a bit of a stretch?
I'm trying to think of what the right cliche is, Clive, especially across cultural boundaries from the United States to the UK.
For
That's
sure.
the $20,000 question. The $20 million question is that, are men and women, do they really experience depression at different rates, or are they more similar? And I think that's really what we're trying to understand.
Okay.
And so I think folks like myself are really trying to chip away at that a little bit more and say,
Okay.
maybe are they more equal if we think about depression in some men differently?
Okay.
And there's some interesting research that looks at that. So, for example, there was a study that was done at the University of Michigan recently, where they took a large database of research that's done, where they collect a national sample of individuals in the United States, big sample, and they look at frequency of diagnoses in the United States. And what they did is they just tweaked the diagnosis, or the diagnostic criteria, the symptoms, a little bit in men, and really made it look a little bit more kind of like what we're talking about here, where there's
Okay.
some like typical symptoms of depression, but also some of these externalizing symptoms.
Okay.
And what happened is the diagnostic rates actually became equal
I see.
between men and women
I
when
see.
they included some of these externalizing symptoms.
I see.
So what studies like that make us think is, if we think about depression in some men, including typical symptoms and externalizing symptoms, maybe they're more equal. And so I think we're really thinking seriously about that. Maybe they are more similar.
I see. I guess, and I'm a total layman here. I have no experience, within this field. I guess one of the things I see personally is that kind of internalized anger, that hostility, that me against the world mentality.
Mm-hmm.
What I see is that they're probably the few emotions that men are allowed to have without a lot of negative social feedback.
Mm-hmm.
I don't know if you could speculate as to what role that would potentially play, or if that's completely inaccurate, in your point of view. And did you find that in your study that these were the emotions that men could simply fall back on without people saying what's up or abandoning them or judging them?
That makes sense. I mean, as you're explaining that, I mean, in that what we found is men reported that they could experience anger and this hostility, and that these symptoms were predictive of this whole range of masculine depressive symptoms. And we think of
Okay.
the model that we use for masculine depression includes these kind of more masculine symptoms, and I won't bore you with the whole list, but then also some kind of typical symptoms too, like I feel
Okay.
sad, I feel blue, I feel down, low energy, things like that. And so I think that makes sense for us if we think of traditional masculinity, that men would be more likely to report things like anger, and that it's acceptable for them to feel angry, and it's okay for them to feel angry, and partly it's what they know.
Yes.
They've learned when you feel, whether you feel sad about something or whether you feel upset about something or whether you feel hurt about something, it's okay to be angry about
Yes.
it.
For
So
sure.
we could anticipate that men would feel, some men, again, not all men, but some men would feel comfortable in that place. And that hostility, I think you captured that kind of me versus the world mentality, seems to be a place that men feel comfortable in and they're used to.
I see. I see. And are there any kind of limitations to the study that would maybe at this stage possibly prevent it from being, let's say, generalized or used within the wider population of men as a guide to either helping the diagnosis or the early identification of depression?
Sure. I think that's an important question, and I'm glad that you bring up that question. I think part of the limitations have to do with population, partly with college students. And so what we have to think about is trying to understand this phenomenon of depression in men, masculine depression, mass depression, male depression, with broader populations. And there's research looking at, a
Okay.
lot looking at college students, but
Okay.
there's some research looking at, for example, clinical populations.
Okay.
So we just need to keep expanding it. And
Okay.
so we need to look at more men out there, and we need to look at just a range of different types of men. So we need to
Okay.
look at, younger men, older men. We need to look at men from, various different racial, ethnic groups,
Mm.
from different experiences. So, like, for example, one of the groups that I'm looking at right now is I'm looking at this masculine depression in homeless men. And
Oh
so what
wow.
does that
Okay.
look like with them? And so I think we just need more data.
For sure.
That's part of it.
Matt, when you conduct that study, can we have another discussion? I would. That's a very, very important area because, of course, I think something like 90% of homeless people are men, and
Right.
of course that there'll be huge amounts of underdiagnosis and
Right.
undiagnosed, mental issues within these men. So when next for the research is the homeless population the kind of next avenue if you, or would you like to take it into, let's say, the population of men as well, or slightly older men perhaps? Or where would you like to take this research next? What's important for you?
I think what we're looking at with looking at homeless men is it's capturing kind of a range of different pieces of this.
Yeah,
So with it, we're looking at a men that's actually a pretty clinical population. These men are
okay,
in quite a bit of distress,
of
and
course.
there's a fair amount of pathology. There's a lot of symptoms these men are experiencing. there's a range of age, so they're not just all young men. There's actually quite a bit of middle-aged and older men.
For
So
sure.
our hope is that we're looking at those pieces. We also want to look at how understanding masculine depression might help us understand suicide too.
Wonderful.
And
Wonderful.
so we're
Okay.
asking these men about their history of suicide, current thoughts of suicide.
Okay.
We're also doing this in college students too. And so our hope is to try and make this connection between masculine depression and suicide, and how might it help us understand suicide in men. And I think that's a big next step for this research, is to try and make a link to, if we can understand depression in men better, how might it help us maybe understand suicide, maybe decrease suicide.
Great. And do you see the research pulling all the way from traditional masculine gender roles, linking into masculine depression, and then going into suicide? Or would that be too much of a link, in your opinion, or too far?
I think that it involves, I mean, I think in an ideal way, Clive, I think it involves kind of linking all of these pieces together of,
Okay.
looking at these atypical symptoms that are in some ways embedded, we think, embedded in traditional masculine gender role norms. And then looking at how that might help us predict, maybe diagnose, assess suicide more accurately, better in men. And so I think it involves putting all those pieces together in some type of, conceptual way.
Okay, great. And would you be, I guess, happy to give any kind of advice to men out there, men like myself? What should we look for in other males in our lives in terms of symptoms, so to possibly then say to these guys, hey, look, you need to get some help. I've noticed you
Sure.
have these symptoms. You've got to get to some, to some kind of therapy.
Sure. I think I can give a little bit.
Okay.
And so, yeah, I think that we can't forget that there are still a number of men who experience like typical, like regular depression.
Yes.
And so we can't forget that there's still a lot of men who are going to look sad. They're going to have low energy. They're going to be down, blue, lethargic. So we can't forget about them. So if you see guys that kind of look more typical, that to notice that and to encourage them to seek help. We can't forget about what we found here too in this research, that if you notice a guy who looks more irritable, angry, maybe short-tempered, that it seems that maybe anger is going to be an indicator of something that's going on here. If you see this guy who looks more angry than normal,
Okay.
then we might want to try and find out a little bit more about what's happening.
Great.
There's other research that shows too, and even though our research didn't find it, there is other research that shows that men are likely going to be at an increased risk to drink
Okay.
and use drugs when they feel depressed. And there's
Okay.
some interesting research that supports that. And so I think we can also look at that. And that's no surprise, I think, when
Of course.
we see a guy who's probably drinking too much, and we might be a little concerned about him, that we might want to follow up on that. And that same research actually shows that more traditional men, though they might say they're going to drink too much, are open to reaching out to somebody who's like a close friend,
Great.
somebody who's in their support network.
Great.
And so I think that we can't forget that even though these guys might be kind of, like traditional, they're not really open to asking out help, they're likely, or at least what we think they're going to be likely, to talking with somebody that they trust.
Great.
And so by reaching out to them, we might be able to at least have that conversation.
I see. Great. Matt,
That's a little bit.
that's wonderful. That's wonderful. As an individual who I've had quite a couple of friends who get onto that path, and
Yeah.
it's devastating to see, and very, very difficult to persuade them to, hey, you've got to go and get some help. That's the most challenging thing for guys.
And it doesn't, the hard thing about it, as you probably know from your experience, is that still in the end, it just doesn't always work. That
For sure.
sometimes we just can't crack through that. That I don't want to get help. I can't trust a counselor,
Yeah,
or I can't go see somebody, or don't talk to me. And sometimes that can be just really, really frustrating.
for sure. Is that the most frustrating thing for you when you're dealing with these men versus, let's say, them coming in much later?
I think the most frustrating thing for me as the clinician, is to then build trust with them,
Okay.
and to help them begin to see counseling as something that can be, a valuable tool for them. And so that can, for some guys, not all guys, but for some guys, that can just be so hard. They see counseling as something of no value and a waste of
Mm,
time and something that won't be helpful. And
I
me, as
see.
somebody who, is not to be trusted. And so that's the
I
hardest
see.
work for me, is to then build that relationship. And it's often slow, and it's very difficult. But with not all guys, but with
Okay.
with many guys, we can get there where we can develop rapport and trust, and do some good work.
Great. Great. That's wonderful. Matt,
Yeah.
I'm very, very grateful for your time. You know,
Yes, I'm glad that we could have a good conversation.
thank
I
you.
enjoyed it.
Thank you. And I'm really, really looking forward to your, the next part of your research on the homeless, men out there. That's tremendously important. So if once you have time after you complete the research and it's published, I'd love to get you back on and just talk about that and how it was designed and what kind of results you're seeing. When do you think that might be available, please?
I mean, the academic timeline is slow,
For sure.
but I would anticipate sometime next year, probably.
Wonderful. And I'm definitely going to keep a lookout for it in the journals. And
Absolutely.
wonderful. Thank you very, very much. And is there anything perhaps that you'd like to add for the listeners who will be listening to this on YouTube?
I don't think so.
Okay.
I'm excited that they're listening. I think that this is such a great resource, and I think that you're doing such necessary work, and I'm glad to see you do it, and I'm really
Thank,
excited about it.
thank you very, very much. It's been a real pleasure, Matt. It's been great. I hope you have a lovely day on your side.
Yeah, thanks so much, Clive. I really appreciate it. Thanks so
Thank
much
you.
for your time.
Thank you. And I'll make sure I send you the link.
Okay, appreciate it.
Thanks, Matt. Bye bye.
Okay, bye
Bye
bye.
bye.